Artificial sweeteners, Splenda, stevia. What should we do about these sorts of things? You've heard good and bad things about this, and the team's put together a really great presentation. So tell us about the artificial world of sweeteners.
Well, to start, we are going to do some rapid fire questions for you, Dr. Curnew, just true or false questions. So, the first one is artificial sweeteners can have a low to modest effect on weight loss. True or false?
It's quite interesting. The response is quite variable. Some people get a response, some people don't. On average, you can lose a little bit of weight with artificial sweeteners compared to real sugar. It's not dramatic, but there's a pound or two here or there. Some show up to 5 pounds, but it's not a lot. Just a very minimal amount, small amounts.
And yeah, actually, that lines up with the data we found is typically true that it's a low to modest effect on weight loss. Now, the next question is some zero calorie sweeteners can shift for your gut microbiome in just a few weeks. True or false?
Yeah, it's kind of interesting. We have billions and trillions of cells in our gut, and we're just trying to understand that. And certainly, what you eat, including artificial sweeteners, can actually shift and change that. Whether or not it has great meaning and impact, we're looking into that right now. So the answer is yes, it can. That's why I'm trying to eat more fermented foods, um, and more fi high fiber foods to get a more favorable microbiome, and artificial sweeteners push in the wrong direction, is my answer.
And we definitely agree it came across as true as it can shift your gut microbiome. So the third question is regular diet soda drinkers have been shown to have a higher risk of diabetes, obesity, and heart disease in observational studies. True or false?
That's absolutely true, but this is observational data. So it's basically is that people who are in trouble with their diets, who have trouble losing weight, always go to or have a higher instance to consuming artificial sweeteners. So that will actually show a worse outcome. Um, and so the randomized data is not quite the same as the observational data. So basically, that answer is it can show a point in the wrong direction.
Yeah, and true is what we found as well. The next question is artificial sweeteners likely have a neutral impact on those with diabetes. True or false?
It depends what you're replacing. So overall is that if you have diabetes, sugar, white flour cause sugar spikes. And I would rather have a little bit of artificial sweetener on that, but I think it's a controversial area. But certainly sugar, white flour are the worst. I think artificial sweeteners are slightly a little bit better. What's the answer?
The answer is true, just based on the research we found as well. Yes. So, our fifth question is artificial sweeteners are associated with less daily sugar intake and total energy intake. True or false?
Yeah, there's a slight reduction in total energy intake by when you replace artificial sweeteners or 0 calories compared to sugar. So I think that's true, but it's just a very, very modest effect.
Actually, you're very correct. Yeah, from what we found is also true that it reduces the intake a little bit there. So the next question is current evidence suggests that low and occasional use of artificial sweeteners is unlikely to have deleterious effects on your body.
I hope that's the case because that's what I'm doing right now is that I have the sweet tooth and the cravings help a little bit by using Pepsi Light, Coke Light, or Coke Zero, whatever. And so I wish I can just live off of water and be a purist and float on air, but I succumb to the cravings, and I've given up regular pop. And also any juices, like if you're having apple juice or orange juice, you're having sugared water. So, um, so I think it's better to have a little bit of artificial sweeteners, but not too much.
Yeah, and you can rest easy, Dr. Curnew. The answer was true from what we found. It does have a low risk on deleterious effects. And then the final question is the long-term effects of heavy use of artificial sweeteners is still inconclusive and uncertain for metabolic health. True or false?
Yeah, so it's pointing that higher amounts are bad. There's some concern in huge amounts, especially in rat models, that it can promote cancer. But there's actually some data if you have excessive amounts, blood clot formation, cancer formation, and can be an issue, and so just don't use very much of it.
Yeah, we're in agreement with that. Like essentially it's still inconclusive, but yes, we're looking at more information, which I'll get into right now. So, artificial sweeteners are substances that provide the sweet taste of sugar, but with little to no calories. They're often used in foods and drinks marketed as diets or sugar-free, and are also found in things like chewing gum, yogurt, protein shakes, and even toothpaste. These sweeteners can be either synthetic, like aspartame or sucralose, or more naturally derived, such as stevia and monk fruits. While they vary in origin, all artificial or high-intensity sweeteners are designed to mimic the sweet taste of sugar in small quantities. In the United States, the FDA has approved 6 artificial sweeteners as safe for use: aspartame, sucralose, saccharine, acesulfame potassium, also known as HK, neotame, and aventame. These are considered high-intensity sweeteners because they are often 100 to 700 times sweeter than regular sugar. There is also stevia and monk fruit, which are considered more naturally derived sugars. While not technically classified under the same category as artificial sweeteners, they've been granted GRAS status, which means generally recognized as safe, and are widely used as natural sugar substitutes. Some sweeteners are also considered heat stable, meaning they don't break down at high temperatures and can be used for baking and cooking. Sucralose and acesulfame potassium are good examples of this, but in contrast, aspartame is typically sensitive to heat and loses its sweetness if heated, so it's mostly used in cold products. Now, there is one important note about cyclamate, the artificial sweetener. It's not FDA approved. In fact, it was banned in the United States in 1970 after early studies in rats suggested a possible link to bladder cancer. However, more recent research has questioned these results, and cyclamate is used in over 100 countries, including Canada and many European nations. However, the FDA has now reversed the ban, so you won't really be finding any of these products in American food.
So, Ryan, my takeaway here is that don't microwave your Diet Coke, right?
Precisely, don't do
Ah,
that.
perfect. Noted.
Yeah. All right, next slide. So, how do these sweeteners work? Well, first, let's talk about the sweetness perception. Artificial sweeteners are often much sweeter than sugar, as I mentioned. For example, sucralose is about 600 times sweeter. This means only a tiny amount is needed to achieve the same taste. They activate the same sweet taste receptors that are found on the tongues as sugar does, tricking our brain into thinking we're eating something sugary, even though there is very little or no actual sugar involved. Now, in terms of digestion and metabolism, most artificial sweeteners aren't fully absorbed or metabolized by the body, which is why they don't add calories or raise blood glucose levels. Let me give you a couple of examples. On the one hand, you have sucralose, which mostly passes through the digestive system unchanged, which is why it contributes 0 calories. On the other hand, aspartame is broken down into amino acids, similar to how proteins from food is broken down. So it does provide few calories, but in such a tiny amount that it's negligible. So the key differences between these sweeteners and sugar come down to calorie content, blood sugar impact, and how they're processed by the body. For people with diabetes or those trying to lose weight or manage calorie intake, these sweeteners can be a useful tool, though they're not without controversy, especially around long-term effects, which are still being studied. Next slide.
So, what happens inside your gut when you consume these artificial sweeteners? Your gut microbiome plays a crucial role in digestion, immunity, and even blood sugar control. Let's look at some studies that suggest artificial sweeteners might significantly alter this microbiome. Next slide. Before that, how is gut health determined? So gut health is generally a state of physical and mental well-being in the absence of gastrointestinal complaints or disease. So if you feel good in your stomach, then and you don't have diseases, then you're probably in good health. Higher microbial diversity is generally associated with better gut health. This can be measured by stool sampling. And some tests are to look at the microbiota specifically associated with inflammation, obesity. Next slide, please. All right. In 2014, researchers conducted a small human trial to test saccarine's effect on the gut. There were 7 healthy volunteers who did not normally consume artificial sweeteners, and they were given the maximum acceptable daily intake of saccharin, which was a high dose, about 5 milligrams per kilogram of body weight, every day for a week. The team then analyzed stool samples to see changes in gut microbiome composition and used oral glucose tolerance tests. So they drank sugar water to measure blood sugar control. And the result was that after 5 to 7 days of saccharin, 4 out of the 7 people developed significantly poorer glucose tolerance. Their blood sugar spiked higher and took longer to come down compared to the response before starting saccharin. These responders also show distinct shifts in their gut bacteria, including an increase in certain species like Bacteroides fragilis and specifically Weissella cibaria, and a decrease in others. The remaining individual did not show such changes, highlighting variability in response. The implication is that this was the first evidence in humans that an artificial sweetener could disrupt the gut microbiome and, in some people, negatively affect blood sugar regulation. Notably, when scientists transferred the gut microbiome from the affected individuals into the germ-free mice, those mice developed similar blood sugar problems. This suggests that the microbiome changes were causing the metabolic effects. In short, saccharin induced in this study microbiome alterations that led to glucose intolerance in a subset of individuals. Next slide, please. And in this newest study is a randomized controlled trial made in 2020. That's what RTC stands for. Another human study examined 2 common non-caloric sweeteners, aspartame and sucralose, to see if they alter the gut microbiome. 17 healthy adults participated in a double-blind crossover trial, and each person consumed aspartame daily for 14 days and sucralose daily for 14 days as well, with a month in between, at doses 15 to 20% of the acceptable daily intake. Researchers collected stool samples before and after each period to analyze the gut bacteria and also measured levels of short-chain fatty acids. And these fatty acids were measured because they are beneficial compounds produced by the gut microbes that indicate gut health. The result was that the study found no significant difference in the gut microbiome before and after consuming either sweetener, and the overall bacterial community composition and diversity remained essentially unchanged. And likewise, there were no changes in the short-chain fatty acid production after the 2 weeks on aspartame or sucralose. This suggests that the bacteria in the gut were functioning normally and maintaining the balance. The findings highlight how dose and context matter. At typical levels of intake, aspartame and sucralose showed minimum impact, which contrasts with the saccharin findings from above. So maybe the type of sweetener and the amount consumed plays a crucial role in gut microbiome. Next slide, please. All right, this is the last study about microbiome. This is an even more recent study, a randomized controlled trial in 2022. This is, I think, by right now, the most comprehensive human study. It examined how different sweeteners affect the microbiome and metabolism in a large randomized controlled trial. Researchers assigned 120 healthy adults who don't normally consume artificial sweeteners into 6 groups. 4 groups consumed one of 4 sweeteners, the ones shown on the slide: saccharin, sucralose, aspartame, and stevia, using the commercially available packets. 6 packets a day for 2 weeks. The doses were below the daily safety limits, but representative of real-world use. And then a fifth group consumed an equivalent amount of glucose to match the sweetener's bulking agent, and a sixth group had no supplements. Throughout the study, participants wore continuous glucose monitors to track blood sugar in real time and underwent periodic glucose tolerance test, which is again the test involving drinking sugar water. Stool and saliva samples were collected before and after the intervention to analyze changes to the gut and oral microbiome. So the result was that all 4 sweeteners groups showed changes in their gut microbiome composition after 14 days, though the specific shifts were distinct for each sweetener. In particular, the saccharine and sucralose groups exhibited the most pronounced microbiome alterations, and these 2 groups also developed significantly worse blood sugar responses. So that's directly opposing to a previous study. During glucose tolerance test, people in the saccharine and sucralose groups had higher blood sugar peaks and slower returns to baseline compared to the control group. This indicates that the sweetener impaired glucose tolerance, which is a tendency towards elevated blood sugar. In contrast, the aspartame and stevia groups did not show a significant change in glucose relative to the controls. All sweeteners groups, however, did experience some microbiome change, even if blood sugar was unaffected in those 2 specific groups. So the implication is that this study reinforces the idea that certain artificial sweeteners can adversely affect blood sugar control by altering the gut microbiome. Some participants showed strong responses while others did not. So a key finding was that the high degree of individual variability. To probe this, scientists also transplanted stool from select individuals into germ-free mice. And remarkably, the mice exhibited blood sugar changes that mirrored the human donor's response. This proves that this suggests that the gut microbes were driving the metabolic effects. It also means the impact of the sweeteners is highly personal. In the researchers' words, human sweetener consumption led to a person-specific, microbiome-dependent glycemic alteration. As we continue to unravel this area, the 2022 results highlight a crucial point, is that artificial sweeteners interact with our gut ecosystem, and those interactions and the consequential health effects can differ greatly from person to person. Next slide, please. So in summary, sweeteners can impact gut microbiome. These effects vary greatly between individuals, and some specific findings from the studies that were mentioned is that saccharine and sucralose were linked to glucose intolerance in some, and aspartame and stevia generally had minimum impact. And moderation is advised until more research is done on this topic. Next slide.
Okay, so we've seen that artificial sweeteners can influence their gut microbiome, but can they also influence the health of our hearts and our brain? So the effects of artificial sweeteners on these organs really depend upon several factors, which we'll talk about in the studies that are coming up. There have been studies that suggest that long-term intake of sweeteners can result in detrimental effects to the heart and the brain. One study was conducted in France with over 100,000 participants who wanted to see if high intake of the sweeteners acesulfame, potassium, and sucralose led to a higher risk for cardiovascular disease compared to the low intake group. Likewise, they wanted to see if aspartame influenced the incidence of cerebral vascular disease in these participants, which is also known as a stroke. Next slide. So what they found was quite interesting. Participants in the high sugar intake group experienced an increased trend in risk for cardiovascular disease events compared to the low intake group. We see this as the high intake group shows 346 participants experienced cardiovascular disease events, whereas in the low intake group, only 314 experienced these cases. This is seen as a 40% increase in incidence when consuming acesulfame potassium and a 31% increased risk when consuming sucralose. Moreover, participants who had high intake of aspartame experienced a higher risk of cerebrovascular disease by about 17%, as 186 of these individuals experienced the event compared to 151 individuals in the low intake group. So, really, the main takeaway from the study is that high consumption of artificial sweeteners may be associated with a 9% increased cardiovascular disease risk, but more research is needed to confirm this connection. Next slide. Now, another study similar to the one previously mentioned shows researchers assessing the sweeteners erythritol and erythronate. Approximately 4,000 participants consumed varying levels of these sweeteners, where the top third of these consumers were considered the top tertile, and the bottom third were considered the bottom tertile. But the researchers went further by conducting a follow-up with these participants, averaging about 8.4 years after their initial experiment, looking to identify possible outcomes of consuming these sweeteners over the long period of time. Next slide. Their data suggested that individuals who were within the highest tertile, again, that top third, for sugar consumption were at greater risk of developing hypertension, diabetes, hyperlipidemia, which is excess lipid levels, or microalbuminuria, which is a lack of albumin protein found within the blood. During the follow-up, participants in the highest tertile of sugar consumption had higher body mass index scores and cardiac biomarkers that indicated issues with their hearts. As well, these individuals experienced a 40% increased risk of stroke, a 30% increased risk of coronary artery disease, a 53% increased risk of heart failure with hospitalization, a 38% increased risk of heart failure with reduced ejection fraction, so there is less blood being pumped out through the heart, a 79% increased risk of cardiovascular death, and a 66% increased risk of total mortality after adjusting for demographics and traditional cardiovascular risk factors. Next slide.
Before I move on, just one thing that I was listening to an interview from the principal investigator of this study, and him and also some of those critiques from other people mentioned that this is a metabolite. If erythritol is a metabolite made by the body through sugar metabolism, so everybody has a little bit of it, different people to varying degrees, and so one of the limitations of this study is that they didn't measure how much this already exists in the people. And so how much of it is natural coming from those conditions of diabetes that is already in there, and how much of it is coming from the artificial sweeteners is a little bit uncertain, because people who have these metabolic comorbidities tend to also have higher levels of this metabolite. So that was a little bit of a problem with this study, but this has been replicated with a similar sugar alcohol. Whenever we're trying to look at causality, we look at something similar. Also xylitol, which is also a sugar alcohol, also found a similar thing recently. And it kind of did this small little experiment in mice, and about 7 or 8, if I'm not wrong, about 7 or 8 humans, and they found that it had an effect on their platelet aggregation, so blood clotting, and so that's what the mechanism hypothesized is at this stage. But bottom line, it's not all doom and gloom. It's not all scare with this, but certainly that's what the data is pointing out towards for these sugar alcohol sweeteners.
Again, this is on observational data that's corrected for all the variables we can, but simply stated as people who use artificial sweeteners are less healthy than people who don't use them. They're in trouble with their weights most of the time, or their diabetes, etc. So these effects are over-exaggerated in observational data, and you'll show us the randomized data where the difference is not as big. But in an ideal world, just drink water. But
Exactly.
I wish I could do it. But
So we've seen that artificial sweeteners may have detrimental effects on the heart and brain, but why are they so hard to stop eating? Well, research has shown that sweeteners may modify the craving centers in our brains. One important region being the nucleus accumbens found in our limbic system, and this is associated with our reward pathway. So when it's activated, we typically feel like we're, having a good time, we're getting rewarded for the experience. This was highlighted in a 2018 review article, which argued that sugars potentially influence the nucleus accumbens pathway using dopamine, this feel-good molecule that elicits anticipatory behavior for eating sugar. Through this method, artificial sweeteners may create a potential feedback loop that promotes continuous seeking of sugary foods for consumption. Now, there was another study in 2012 where it was looking at 25 females who were eating sugary chips and then viewing food items while undergoing a magnetic resonance imaging or MRI to interpret the activity levels in their nucleus accumbens. The results indicated that participants who ate more chips experienced an increase in activity in their left nucleus accumbens, which suggested that these individuals experienced an increase in their craving for these chips. This occurred despite their hunger levels, which apparently demonstrated a weaker relationship with the activity in their nucleus accumbens. So this paper was trying to argue that the eating of these sugary chips was associated with cravings instead of their actual hunger levels.
So this reminds me of let's just go back a little bit here. Is that the food industry is not your friend. Um, Basically, what the food industry wants you to do is eat more of their foods. And you can see that our metabolic health has really gotten really quite bad over the last 20, 30 years. We've had a more than tripling of diabetes. The average Canadian is overweight. Average world person is overweight. And the food industry knows this. They've actually done wonderful studies, and by giving you foods like potato chips and processed foods, which could be up to 70% of some of our caloric intake, stimulates dopamine, makes us crave, makes us addicted to bad food. And so right now is that 80% of the food is actually controlled by 10 corporations that don't have your interest at heart. And I'm hoping that we do something about this at some point in time. And simply switching from sugar to artificial sweeteners is a step in the right direction, I think. I can't be 100% sure, but wouldn't it be better if we can just have, I'm just having a nice big salad over here. Um, and I'm feeding my microbiome, but I still crave potato chips. And if I have one potato chip, I eat a whole bloody bag of those potato chips. So I don't have that control. So and the food industry knows that, and they created food to be problematic about this. And thank you for showing some of these pathways. So keep telling us more. We're learning all the time.
Well, there was one other study that assessed the effects of sucralose, but it was in rats. And it wanted to determine if increasing the sucralose intake led to an increase in the food intake of these rats. The researchers went further, though, as they investigated the changes in dopamine within their brains, looking to determine if sugar had an impact on the levels of the molecule within the nucleus accumbens. To assess this, they used 0.03 molar, 0.1 molar, and 0.3 molar concentrations of sucralose, so basically low to high amounts, and inserted a gastric cannula in the rat's brain to assess the changes in these dopamine levels. Next slide. So what they found was actually quite striking, as rats who were in the higher sucralose concentration drank more of the sugary solution compared to their counterparts in the lower sugar concentration conditions. What is more interesting is that dopamine levels were shown to increase in a similar fashion with the increase in sucralose concentration, showing up to a 145% increase at the 0.3 molar sucralose concentration condition. And that could be seen in the graph right there, that little rectangular box going from baseline all the way up to 145% for the triangle, which is the 0.3 molar condition. This suggests the sugar is increasing dopamine within the nucleus accumbens and appears to be utilizing the pleasure-seeking pathway in our brain. Now, this can lead to health problems such as obesity and diabetes, but further research in humans is required to support these results. Next slide. But does this craving effect actually apply to artificial sweeteners? Well, as it turns out, a 2024 meta-analysis of 21 randomized control trials found that participants experienced a reduction in total energy of around 175 calories per day when artificial sweeteners were ingested compared to sugar. This suggests participants ate less food after ingesting artificial sweeteners than when they had the actual sugar. This effect was also supported by the observation that artificial sweeteners and water conditions had no real differences in energy level compared when comparing them, arguing that sugar is the main component of this craving that participants were experiencing.
Thanks,
Next
Ryan.
slide.
Yeah, so that was interesting. Lots of mechanistic data. Now we're gonna switch gears and talk about human data a little bit. Now, what you see here is a triangle. I want to talk about what this is here. What we talked about right now is some of the lower qualities of evidence, observational, where you have some so-called confounders. One example we gave was that someone who is more likely to consume artificial sweeteners, maybe someone with already established diabetes, heart disease, who's trying to correct or maybe lower their risk. And so that's not the same person as someone without the comorbidities. That changes the story a little bit. Now we're going to look at randomized controlled trials and the synthesis of randomized controlled trials. And you can see here, they are the top quality evidence minus your mom's advice. So that always trumps everything. But if we look at the data on the left, four main outcomes: blood sugar, weight loss, lipids, and CVD cardiovascular disease. Now, blood sugar, there was a 2018 meta-analysis of 29 RCTs, and they look at the aspartame, saccharine, and sucralose, one of the top three common artificial sweeteners used right now, and they found no elevation in blood sugar post consumption. Now, weight loss, we mentioned this very early on. It has a modest, very small effect, probably less than a kilogram, less than a pound or two of body weight. In the combination of all the RCTs, 79 RCTs and 22 prospective studies. So that's a lot of people, and there's a lot of studies in 2024 analysis. So a minimal BMI reduction of 0.114. I did some math to figure out what that translates to. It translates to 0.3 kilograms for a 5'4" individual of around 150 pounds. So it's not a lot, very modest and very light. Lipids, no major effect in the ones that we care about for cardiometabolic health and heart attack risk. Triglycerides, LDL, HDL, different story there. But again, no major effect. And for actual outcome data for cardiovascular disease, interesting, the 2 points. First point is that there was a dose response effect seen that showed an increased risk of all-cause mortality and CVD mortality with artificial sweeteners, which is not a surprise. We mentioned that early on, that in prospective observational studies you see that. But when they compared it to replacing sugar, for every 1 can replaced, there was a lower risk, 4 to 6% of all-cause and CVD mortalities. So you can see two sides of the same coin there, where one points towards increased risk, one points towards less risk if you're replacing something else, which is called sugar.
So one message that I often take away things in observational data, well, die in beds. Beds are associated with increased mortality. We don't think beds kill us. Um, and you can correct for all the variables you want. So in most situations, when you see a 50% change in observational data, um, or up to a doubling, it's often relate to confounding factors or just that the unhealthy people are here consuming the artificial sweeteners. Yes, we try to correct for all the variables, blood pressure, smoking age, etc., but we have trouble doing that. And when the randomized data are the strongest evidence where the computer selects what form of therapy, you show you know a pound or two reduction. You show no neutrality on lipids and a trend to a beneficial effect on cardiovascular mortality. Um, I tend to believe that it is that in the scheme of things, water is king for beverages. In fact, having 2 glasses of water before every meal has been associated in randomized data sets to lower 5 pounds. the response to artificial sweeteners are variable, but they're modest and in the right direction. Um, but you still have well collected observational data that show that sticky stuff, platelets, changing the microbiome, and maybe cancer as well, which we'll explore a little bit more. So it's not a free pass, but that's why you'll see so many controversial areas because you guys did a wonderful job of trying to summarize everything. Is that it's not a straight yes or no. Keep telling us more. Thank you so much.
Yeah, and one outcome data that we couldn't fit on that slide was diabetes. Probably one of the major reasons, maybe other than weight loss, that people want to turn to artificial sweeteners, um, or people who already have it and you want to find a better replacement. Now, there was a somewhat controversial WHO systematic review and meta-analysis 2022, but it's one of the most comprehensive data sets to date, and they look at essentially, in layman terms, does it give you diabetes? In someone like myself, someone who's healthy, maybe pre-diabetes, maybe HbA1c, which is your average blood sugar attached to red blood cells at 5.5%, is that going to cause diabetes? They looked at something called incident type 2 diabetes through beverages, through tabletops. Now, something called cohorts. Cohorts are observational data sets, exactly what Dr. Curnew mentioned. The observational point towards risk. The bolded data here, HR stands for hazard ratio 1.34, that translates to 34% increased risk. And the first one for type 2 diabetes from beverages is 23%. But you can actually look at some of the other parameters, HbA1c, fasting glucose from RCTs, pretty much neutral, right? And there's a good example where the two different study design are telling a different story, okay? So it's not going to give you diabetes, essentially. And actually, on top of that, what if you don't have diabetes? That's already answered here. But if you do have diabetes, the Cochrane, which is another team, they do synthesizing of evidence through systematic reviews and meta-analysis. They looked at a group of about 1,000 people through 9 RCTs who already had type 1 or type 2 diabetes, and they also found no difference between these artificial sweeteners and their impacts on things like HbA1c, which we use, body weight, and other side effects. So the story is not as grim as some people want to put out to be, even with diabetes in this case. Now, sugar intake does, we briefly mentioned this, sugar intake actually goes lower when you replace it, whether you replace artificial sweeteners with sugar, not a surprise. And you can see the data here supporting that. A combination of all the randomized controlled trials from a number of studies here. You can take a pause and look. Now, CVD again, cardiovascular outcomes, you can see summary here. Again, the bolded ones are the statistically significant data, which means the real effects, the real numbers, they're not due to chance. And you can see that, again, observational cohort studies are showing a little bit of risk. When we look at some of the randomized data sets, the blood pressure data, the lipid data is not pointing towards that risk. Of course, those are only two different risk factors for heart disease. There's other things not shown here. But the story is the same. Observational data shows a little bit of a different story. And that's part of the confusion. That's why we keep mentioning it. When you ask someone, are artificial sweeteners bad and good? Depending on what you look at, you get to different conclusions. Cancer. This is a long table. We just put it for anyone who's curious to stop and take a look. But essentially, the bottom line is that there's no real risk when you take a look at the totality of the evidence for all the cancers. A little bit of signal for bladder cancer, and this was through the WHO report. And they also mentioned that the majority of those studies for bladder cancer was regarding tabletop saccharine. So it's not all artificial sweeteners. And that was a 31% risk. And that's, again, is from 26 case controls. So again, you're not going to randomize people to have it and look for bladder cancer in this case. So take it with a grain of salt, and take it with a grain of natural salt here. So cancer, inconclusive.
Here are some alternatives and moderations instead of using sugar, alcohols, and chemical sweeteners. There's also stevia, honey, and monk fruit. These are only stevia and monk fruit is nutritive, so they don't have nutrition. But honey actually will definitely increase your blood glucose. So depending on your purpose for using artificial sweeteners, or like your purpose for using sweeteners in general, maybe stevia and monk fruits will be your natural choices. But like in terms of natural, they will still have effect on your health. So it's not that they don't have an effect. So for stevia, it's derived from the leaves of the stevia plant. It's non-caloric and it can be significantly sweeter than sugar. For honey, it provides some nutritional benefits over refined sugar, but should be consumed in moderation due to their high sugar content. So if you're looking for alternative sweeteners for the sake of diabetes, honey will probably not be a good choice for you. For monk fruit, this contains antioxidant compounds, and studies have shown that this may reduce markers of inflammation. Next slide, please.
Actually, just stay on that slide one more time. We'll go back there. So it's interesting is that honey is very popularized. All this honey is glorified sugar, table sugar, with a few antioxidants thrown into the mixture. So um, I don't think honey is a choice for health compared to sugar. Stevia and monk fruits, interesting, is that you go to some people feel because they're natural, they must be safer. I always say that tobacco is very natural, cyanide's um, very natural, and none of these are safe. So I'm I sort of lump most of the artificial sweeteners together, and I think most of us when we buy them, we don't pay a huge difference to what we're looking at there right now. So I really like your data about how in some people it changes the microbiome, others it doesn't, individual variations, and I think you have to try different things, but don't walk away saying that stevia, monk fruit, or honey are well, first of all, honey is the same thing as table sugar in my mind. You mentioned it for diabetes. One thing that artificial sweeteners do is that they have less dental caries, less cavities. So that's actually a positive effect. And what you're showing me is that there's a lot of individual variation. Try these things using small amounts, but I'm not sold stevia and monk fruit at this point in time, but it's interesting. It's, some people feel totally different about that. Keep telling us more.
And another key takeaway is if you're gonna have artificial sweetness, have it with a bowl of vegetables, get all the colorful vegetables, and then probably doesn't work that way, but kind of neutralize the antimicrobe effect and replace the good bacteria there.
Okay, so the key takeaways from our presentation are as follows. The consumption of artificial sweeteners may result in an altered gut microbiome, which can lead to potentially harmful effects on our metabolic health. At the same time, consuming sweeteners may lead to health problems associated with the heart and the brain, such as hypertension, cardiovascular disease, and cerebrovascular disease. Now, we recommend that you try to reduce the sugar as much as possible, your sugar intake. And if that means taking more natural alternatives such as stevia and monk fruits, that would be okay, but it's still good to reduce it as much as possible. Uh, and with that, actually, we are finished with our presentation, and we'd like to thank you all for listening.
Fantastic. So what I'm just having over here is I have kombucha, which is fermented tea. I dilute it 50% with water and 50% kombucha. I just had this nice salad. I had the whole thing. I had some salad, I had two salad. I had about equivalent of four salads tonight, and in there I threw in some fish in there, and that's what I'm eating right now. I would like to. I would like to have a Diet Coke right now. No, just kidding. But it's interesting. So you convinced me that people are sort of scratch their head, which is good. I'll take away is my number one beverage is still water. But we get bored like variation. I'm eating a lot more kombucha at this point in time. I'm trying to drink less diet pop than before, and I'm trying to avoid artificial sweeteners, but I would rather have artificial sweeteners than sugar. So you mentioned glucose monitors, is that many of us, including myself, are prone to diabetes. And you can actually put a glucose monitor called a Libre 2 device or a Dexcom on yourself for a couple of weeks and try a personal experiment. Um, I'm not sure you should analyze your poop and try to figure out what your microbiome looks like, but eat lots of fiber and high fiber foods and try different things. And so I think that's great. Um, Rad, what's your thoughts?
Yeah, my thoughts. So I'm not a huge fan of artificial sweeteners, but I cannot have coffee without putting that little. So the one I use is Sweet and Low, and I Googled it to see. I have no look at, never looked at the back to see what the ingredient is. Now it's cyclamate, which is allowed in Canada. So essentially, my takeaway is I'm probably not going to change things that much. The data is not scary enough, and if you go on social media and internet, Doctor Google, you put artificial sweeteners, you get people who exaggerating the truth, twisting it. And it was kind of disappointing. The author, the principal investigator of that erythritol study that I was listening to from the Cleveland Clinic, actually, I posted it on their channel. They were not speaking like scientists. They were talking about how this is a greater risk factor than smoking and blood pressure. I just could not. So essentially, the hype is not always in line with what the data shows. We tried to put the data for any curious people, patients, um, uh, providers, everybody else. But again, I was telling the team about Utah, the capital soda drinker of the world. Maybe they have to watch this webinar and change that a little bit. And they don't have diet coke, diet and mix, so everything. But for an occasional use, I don't think it's going to kill us, probably.
Uh, Jing and Ryan, what are you going to do differently after putting all this work together? And thank you so much for really pointing out so much information.
Yeah, of course. Honestly, I want to cut back on my sugar intake as much as possible, but I'm kind of bad. I still take in sugar once in a while, so I'm trying to hopefully balance it out with exercise, with reducing my stress, with drinking more water, and hopefully, like I'll be able to live a healthy, long life by doing that.
Yeah, I used to wear, you mentioned glucose monitors. I used to wear one of those as well. And I think for a while I cut out my sugar, but I think I'm just taking it back in. And like in terms of coffee, okay, I'm not unmuted. In terms of coffee, doesn't milk also have sugar? Like it tastes sweet.
Well,
And
lactose, I guess you could count
yeah.
that as as
Right,
sugar.
the milk is sugar, but it also has a lot more micronutrients from, calcium, some protein, and so one of the things that I did is that for my coffee is that I don't need the artificial sweeteners. Like at one time that double double is double killing you. Cream and sugar is not a good choice. Um, Black coffee is ideal, but you're right, you want that taste. So I was putting oat milk in my coffee, and I thought that was
Yeah.
a good solution. But the problem with oat milk is that it's very high sugar content, and that can actually spike your sugar. Soy milk may be a better choice, and
Almond, is that better, Dr. Kernda?
yeah, almond has
Comparable?
I mean it has less calories,
Mm.
but doesn't have that same richness as you get from other milks as well. So
Mm.
uh, what I'm trying to do is I'm decreasing my dairy and trying to put some more plant-based milks in there. So some soya, some almond milk. I've given up on oat milk just because of the sugar content, but I still have skim milk as well. So I have that little mixture of all the above in there. And coffee turns out to be a good healthy food. It's rich in antioxidants and some of our fast metabolizers, slow metabolism. So I changed my eating habits quite dramatically the last little while. I learned that time restricted eating, you eat about potentially 500 less calories. Um, and I find that for myself, it's that the ideal window of eating is between 8 in the morning to 4 in the afternoon for most people from a metabolic perspective, a health perspective. But I'm a nighttime eater. No matter what I do, I'm always eating at nighttime. So what I decided to do is that my last meal was around midnight last night, and then I burp and go to bed. And then I try to exercise in the morning. So this morning I was out riding my bike, doing hills. Tomorrow I'm going to be weightlifting, and I'm just going to drink coffee with a little bit of milk in it to hopefully around 4 o'clock tomorrow afternoon. And I feel very energized because I don't have that metabolic increase. And we know that, food can be very inflammatory for some of us. And I feel more euphoric for a number of hours there. And when it comes to artificial sweeteners, I try to I'm quite impressed with my kids, and we put cold water in the fridge, and they're happy with that. And but my wife and I sometimes we fall off the wagon, and we drink too much Diet Pop. Unfortunately, my office is at Shoppers, and on Saturdays and Sundays there's always a discount on pop, and so we get the Diet Pepsi or the Diet Coke, whatever they have over there, and put in the fridge, and but I struggle, and you can see the data is controversial, but it points that there's effects of the microbiome, and we're still learning a lot about that. It's still a big unknown, but when you talk about, these rat experiments where you take, you know, you transport um, bacteria or poop from one animal to another from humans, you can actually worsen blood sugar control. So it
Yeah.
really points in some of those directions. So treat your microbiome quite nicely. So have lots of salads, lots of fiber, have some kombucha, have some water. And if you're a perfect saint and can walk on water, you'll never have any diet anything. You'll always be healthy weight. You'll be exercising 17 or 2 hours a day. We'll be meditating, getting 6 to 8 hours sleep every night, but we're human. And um, so just take all this. And so it just tells me I'm still gonna consume um, diet, diet drinks, diet foods, but to a much less degree. I'm gonna try to replace it with water. And I'll go through periods of time where I do a good or better job at that. And you guys showed me so many aspects to think about. So everybody has to think about this. And also, individual variations are important.
Yep.
I kind of think is that if your hemoglobin A1C, let's say it's above 5.7% or so, you're pre-diabetic. Uh, you might want to do some experiment on yourself. Get a glucose meter for, a Libre 2 device if you want for 2 weeks. And I do this very periodically. And the number one way to lower your blood sugar is to lose weight. And if you want to put diabetes into remission, you lose 20 to 30 pounds, you keep it off, you can put diabetes into remission, and 70% of people keep it that way. But the problem is, most of us will drift back on that other direction, but keep working at it. Long-winded answer.
No,
I'm
that's
going
wonderful. Thanks, that's amazing.
to, Rad, you get the final word.
Final word. Risk benefit analysis is honestly what I think about. The benefit for me right now is moderation is probably the best way to go. And again, if you're someone's a heavy drinker of artificial sweetener beverages, maybe think about it. But I think for most people, it's probably not gonna make me lose sleep. That's my final answer.
And I'm going to throw one more thing too as well, is that we have extremely well collected observational data about exercise, is that getting more physically fit. Starting walking is the first thing, but getting at the high intensity, there's a difference in mortality by a factor of five. You're 5 times more likely to die if you don't do any exercise because someone who's extremely fit. And if you want to become an old person, then don't do any resistance training and lose 50% of your muscle mass. Um, is that it takes a lot of hard work to lower your blood sugar with exercise and resistance training. So those things are really outpower all this stuff about artificial sweeteners. And if you want to go to the gym, have your protein shake, I don't know, and put a little artificial sweetener in there, but go to the gym. That's where you get the most benefit. And
Fantastic.
and we wish everybody a great night, and we thank Jing and Ryan for such a wonderful presentation, and you too is Rad. You keep teaching me a lot, and thank you so much. Have a
Good
great
night,
night, everyone.
everyone. Thank you so much.
Good night.
So much. Good night.